So, how common is constipation in children?
So constipation is a very common problem in children in UK. Almost 30% of the children suffer from constipation. It's a very common condition.
What is constipation?
Constipation is that if the child is passing hard stool, sometimes the stool is so hard that it can cause bleeding. But in terms of frequency, if it is less than 3 per week, and especially if it is hard and causing stress to the child, that is constipation.
Thank you. What are the common causes of constipation in children?
So the common causes are mainly the dietary one, which we also call idiopathic chronic constipation, like if the child is not uh, taking enough fiber in the diet, not drinking enough, and also that if the toilet training has not been done properly, child is holding the stool, these all are the causes. But there could be surgical conditions like Hirschsprung's disease or hypothyroidism. So there could be surgical condition, but it's the habitual idiopathic medical constipation.
Oh, thank you. What are the signs and symptoms of constipation in children?
So the signs or and symptoms are that the child will be very stressed to pass a stool. It is sometimes painful for them as well because of the hard stool. They do get cracks in the bottom area and they withhold, they avoid going to uh, toilet for passing stool. So those are the main thing, but we have a Bristol chart. We show parents and that what is the nature of the stool, and usually parents or a bigger child can tell the nature of the stool, uh, which guides us to diagnose constipation, but most of the diagnoses are clinical.
Okay. And how is constipation diagnosed?
So, as I said, diagnosis is mainly clinical. The child will be passing stool less frequently, that is less than 3 per week. Also, they will be passing hard stool. It could be very painful. Sometimes it can cause bleeding as well. So it's mainly clinical, but yes, if uh, um, in some cases there are surgical cause as well, and for that they need further investigations.
Okay. How is constipation in children treated? Like you mentioned a few things.
So constipation is mainly treated medically. As I said, that most of the constipations are idiopathic constipations. So that means giving enough fiber in the diet, fruits, vegetable, giving enough drink. Child should be well hydrated, and also proper training. There should be an habit that the child should go to the toilet at a regular interval, which uh, makes the child training between brain and his or her bowel habit more regularly. So that's the main thing.
Okay, thank you, Dr. Sinha. Would you say that constipation in children is a long term problem?
Yes, it can become long-term problem if not treated early, and especially the child is not being given enough fruits, vegetable, enough drinks in the diet, and of course the long-term treatment needs longer treatment, more medication. It takes longer to be cured, and sometimes it can becomes that worse that they need even surgical intervention.
Oh, thank you so much. So, in your opinion, when should parents seek medical advice?
So I think the parent should seek advice as early as possible. If they have noticed for 2 weeks that the child is not going to toilet regularly, that means less than 3 per week, or passing hard stool, or withholding the poo, withholding going to the toilet, they should contact doctor as soon as possible, because the earlier they come, it's easier to treat and better the outcome.
Thank you so much for it was very informative.